how can you naturally improve your testosterone? Or what can you do instead of taking testosterone replacement therapy if you truly have low testosterone? I'm Dr. Rena Malik, urologist and pelvic surgeon. Low testosterone is extremely common. Up to 30% of men over the age of 45 have low levels of testosterone. And low levels of testosterone and hypogonadism, which is the clinical syndrome associated with low testosterone, is extremely common. In fact, when you look at hypogonadism or the clinical symptoms associated with low testosterone, about 20% of men over the age of 60, 30% of men over the age of 70, and nearly half of men over the age of 80 suffer from symptoms. Now, what symptoms can you see? So men who have a low level of testosterone can have symptoms including brain fog, sexual dysfunction, including low desire, difficulty with erections, mood changes, difficulty in gaining muscle mass, having increased weight due to increased fat, fatigue, and even just loss of vitality or energy for the things that you used to do. Now, while testosterone replacement therapy is very effective in improving these symptoms, it can cause some unwanted side effects, some of which include having your testicles shrink in size because your natural production of testosterone decreases, or also having infertility because your body's no longer producing testosterone and subsequently not producing enough sperm. So what can you do before you try testosterone replacement to improve your testosterone levels? Now, first off, we know that men who have low testosterone and symptoms often have one of three conditions that are associated with metabolic syndrome. This can include diabetes, high blood pressure, and high cholesterol. Now, the first things first is you can work on improving those conditions. You can try to lose weight if you're overweight. You can work on improving your blood pressure, improving your cholesterol, and reducing your blood sugars if you're diabetic. Now, first off, let's talk about diet and exercise. So there's been about 4 studies that have looked at diet and exercise specifically for increasing testosterone levels. So when looking at randomized controlled trials, meaning they put people into either diet or lifestyle changes, exercise changes, and they put another group and did not, and they looked at changes in testosterone levels. So one study looked at a 12-week randomized controlled trial where people were randomized to do aerobic exercise 3 times a week and limit their diet to 1,860 calories per day for 12 weeks. And at the end of the study, they found that there was a significant difference in terms of testosterone levels. However, the difference in testosterone levels on average was about 25 nanograms per deciliter. So not a huge change. I think the important part here is that they focused on aerobic exercise, which is great for weight loss. But if you're doing too much aerobic exercise, that can increase stress. So if you're an endurance athlete and you're doing tons of running, ultra marathons, then that can increase your cortisol level, which can then dampen your testosterone level. And I've talked all about what type of exercise is best for boosting testosterone in a video previously, so make sure you check that one out. Another very small study looked at men and they put them through a 52-week intensive monitored program with both dietitians and physiotherapists, and again saw this small increase in testosterone that was statistically significant. But the more interesting part of that is that these people recovered from their metabolic syndrome. And what does that mean exactly? They had decreased their waist circumference to less than 40 inches. They had decreased their blood pressure to less than 130/85. They had decreased their triglyceride level below 150. They had increased their HDL above 40 and decreased their LDL below 100. And as I mentioned before, there's actually been multiple studies that have shown that there is a link between metabolic syndrome and having low testosterone. So the more metabolic issues that you have, which are any of these issues that I've described, or diabetes, or high cholesterol, or high blood pressure, this raises the likelihood that you're going to have low testosterone. And having low testosterone also makes it more likely that you will develop metabolic syndrome. Now, the more interesting study was a randomized controlled trial of adult men between the ages of 40 and 79 who were randomized to receive a diet and weight loss regimen. And they found that those men who lost 10% of their body weight had an 85-point increase in testosterone levels. Now, that is pretty impressive to me and really good indicator that if you are overweight, losing weight will significantly improve your testosterone levels. Now, there's also been meta-analyses looking at men who've undergone bariatric surgery, and they found that essentially weight loss, even with bariatric surgery, results in quite significant increases in testosterone levels. So ultimately, it's unequivocal that weight loss can help and diet can help. And the most rigorously studied diet is the Mediterranean diet, which essentially includes high intakes of vegetables, poultry, eggs, low-fat dairy, and essentially healthy fats. So olive oil and nuts, these are healthy fats. You actually don't want to go on too much of a low-fat diet because that can actually reduce your testosterone level as well. So if you have sleep apnea, that has been found to be correlated with low testosterone. So what is sleep apnea? It's when you restrict your oxygen intake at night because you're having apneic episodes, meaning you're breath holding in the middle of the night, and it's causing reduced oxygen levels. So this reduced oxygen levels can actually cause blunting of LH, which is the hormone that sends signals to the testicles to create testosterone. And so what they found is that when they surgically correct sleep apnea, there is a significant improvement in testosterone levels. However, more commonly, people are using things like CPAP or continuous positive airway pressure to improve sleep apnea. There was a study done in 2016 where they took 153 men who had obstructive sleep apnea and 60 men who didn't, and they provided those men with sleep apnea with a nasal CPAP, so a machine that goes on the nose that reduces sleep apneic episodes. And what they found was that these men who used the nasal CPAP compared to the men who have obstructive sleep apnea and didn't get the nasal CPAP, they saw a 222 nanogram per deciliter increase in testosterone levels. So if you have sleep apnea, it is extremely important to get that corrected before you try any sort of testosterone replacement. One, because testosterone replacement can exacerbate sleep apnea. And if you have sleep apnea, you may find that you're more likely to have side effects with the testosterone replacement, including erythrocytosis or increase in blood cell count, which can put you at higher risk for things like stroke or blood clot. However, there have been data about the quality of your sleep. So essentially, they found that sleeping less than 5 hours a night compared to those who sleep 8 hours or more had a 10 to 15% reduction in their testosterone levels. Also, they've looked at when you sleep, and they found that sleeping in the earlier part of the night, so that first stretch of sleep, is significantly more important for testosterone preservation than the late night. So if you wake up between 4 and 8 a.m., they've not found as much of a problem in terms of testosterone levels. So getting to bed at a reasonable time every single night and getting good high quality sleep can be seriously important for improving your testosterone levels. The next thing is stress. So stress is so ubiquitous in today's society, but certainly more stress is never good. And in terms of testosterone, stress increases cortisol, and cortisol may actually inhibit the production of testosterone by inhibiting certain enzymatic pathways that lead to testosterone production. And so ultimately, what do we know about how stress affects people's testosterone levels? So in one study, they looked at what things correlated with having hypogonadism or having low testosterone and symptoms. And what they found was that having high work-related stress was significantly associated with having lower levels of testosterone and symptoms associated with hypogonadism. And that was common in people who worked more than one job, who had a longer than 1 hour commute to work, who had often had sales quotas or deadlines, and had often fears of layoffs or mergers. And so work stress can be significantly detrimental to your testosterone levels. Another example is where they looked at medical residents. So medical residents are often stressed all the time because they're put into new situations where they're taking care of patients and often life or death situations. Also, they're on call. So they're often sleep deprived because they're up every 4 nights to take care of patients. And so their sleep cycles are often off. And this was a small study, but they compared men who were residents, so who were Q4 call, high stress job, compared to other hospital employees who were also men, who may have some stress in their job, obviously, because they work in a healthcare setting, but certainly not quite as significant as those residents. And what they found was that there was essentially a 250 nanogram per deciliter difference in testosterone levels for those residents compared to those other hospital employees. That's really significant. So ultimately, finding ways, if it's within your power, to reduce your stress, live closer to work, find if stress and deadlines are really affecting you negatively, then looking for alternative options that you can still work for, but not maybe have that stress pressure at work. Realizing that this is affecting your quality of life and a whole host of other issues can be important if it's available to you. And I realize that it's not available to everybody. Some people really have to work more than one job or need to commute that far because there are no jobs closer to them. And ultimately, if that is your circumstance, then you need to work a little bit in terms of reducing stress when you're home or on that commute so that you can sort of leave work at work and try not to bring that stress home with you. And lastly, varicoceles. So varicoceles are when there is a dilation of the veins that are around the cord that leads to the testicle. And this dilation of veins then causes an increase in temperature in that area that can then affect testicular cell function, including Leydig cell function, which then produces testosterone. Now, varicocele treatment is typically done for men who are infertile or they're having testicular shrinking due to the varicocele. So not everyone needs a surgical treatment for a varicocele, but they have looked at men who've undergone varicoceles and looked at their change in testosterone levels. Now, there have been a host of studies looking at these infertile men's testosterones before and after varicocelectomy. And what they've seen is that it's about a 90 nanogram per deciliter increase in testosterone levels after varicocele repair. Now, this is encouraging in terms of seeing that, yes, there is a testosterone improvement after surgery. However, all of these studies have been done on infertile men, not men who are necessarily have had their children and are subsequently presenting for low testosterone. So it still remains to be seen if a person who has had children and has had normal fertility is actually having an impact on their testosterone from varicoceles, because varicoceles are very, very common. In fact, 15 to 20% of men who are normally fertile will have a varicocele, whereas when you're looking at men who have infertility, 40% of them will have some presence of a varicocele. So is doing surgery on all of these varicoceles going to improve testosterone enough to make the risks of a varicocele repair worth it? It remains unclear at this point. Bottom line, what can you do to improve your testosterone levels naturally? One is improve your diet, increase your exercise, and reduce your weight. Also, increase your resistance training of your large muscle groups, which I've talked about previously in a couple of videos about how that improves testosterone levels. Reduce your stress, improve your sleep, and if you have sleep apnea, treat it with a continuous positive airway pressure or CPAP machine, as that will improve your testosterone as well. Consider getting a varicocele repair if you are infertile and you are having issues with testosterone as well. Improving or treating the varicocele may improve your testosterone as well. And lastly, which I talked about in my video last week, is reduce your exposure to endocrine disrupting chemicals, as this can negatively impact your testosterone levels. And if these things are not working, we have a whole host of medical and on-label treatments for testosterone replacement, as well as off-label treatments that can help preserve fertility in those who want to. And if you want to learn more about that, please comment below and let me know. And as always, remember to take care of yourself because you're worth it.